Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
So great to be with you, Gertrude. My name is Mackinnon Engen, and I lead an incredible organization called Watsi that I'm excited to share more with you about. Along with my own story, I'm saying hello from Madison, Wisconsin, just about 2 hours from Chicago, for those of you who might not know Wisconsin or the middle of America map too well. And I have heard Madison is a bit like Melbourne, but I need to come visit maybe and see for myself one day. So I'm just excited to be here. I think everyone has such a beautiful story to share. I'm excited to share my own today, but mostly also we work every day to unlock the stories of everybody and help connect people around the world, to bring us all closer and make our stories even brighter and more connected. So a little bit about my journey. I was born here in Madison and moved away for many, many years, and only recently am back, mostly to be close to family. But a bit about the wandering path that I've been on. So Madison is a state capital, a university town, but it is actually quite a small town. And so growing up, my family really tried to still show me that there was a big, huge world out there. My parents loved to travel, to talk about what was happening all over the world. And we grew up with a very global view of what was going on, and how our actions could actually interact with other people around the world, even though we were far away and living in a relatively small place. I'm the youngest of three, but a bit of a unique family. My brother, who was about 10 years older than me, had quite severe disabilities. So I grew up really, something my dad likes to say is we were best friends since I was really young. And our family just operated really like a cohesive unit, because that's what we needed to do to get by. So, from my very young age, just had an incredible relationship with so many adults and family friends. And that really helped show me that there was so much possibility out in the world of what I could be up to. Anything I wanted to pursue felt like it was an opportunity to me. In some ways, I think something of the youth now and something I experienced was in some aspect, we'll have too many opportunities open to us. And a huge part of life is figuring out what doors you do walk through. So I've walked through some amazing ones. I left for school in St. Louis and met the best friends of my life. But something pretty cool was I ended up studying, not what I planned, I ended up studying anthropology. And many people are like, why would you study that? What can you actually do with anthropology in this modern world we live in? But it really trained my brain to be able to notice what was going on around, how relationships and the people in communities actually interact and what dynamics are shaping them. And one of the biggest skills that I left college with was how to ask the right questions to figure out what was going on. What's motivating people? What's bringing people together? What's keeping them apart? And so I've been able to use those lessons from my anthropology degree my whole life on a daily basis, whether I'm parenting, running my organization, landing in a new country. Those lessons of how to ask the right questions, who to be talking to, and how to figure out very quickly what's going on is an incredible lifelong skill that I've carried forward from that time. And then I would say something that's been a big part of who I am is I spent my 20s moving a lot. I lived on 4 different continents. I joined the UN and was part of their humanitarian response team. So I was trying to help people in very vulnerable moments of their life. And at the same time, I was also seeing systems and structures that were incredibly broken and inequitable. So this really, for me, at a very young age, I was probably 23 or 24 when the a huge disaster happened in Southeast Asia. Some people might remember the Indian Ocean tsunami. And I showed up to be part of the team that was responding. And we found that the investments that were being made after the emergency were not actually what the community wanted or needed. And this is one of the most formative moments I remember professionally. Billions of dollars had come in, so much time and effort from people all around the world, outpouring of support, but it wasn't actually anchored in what the community needed to rebuild their lives. And so this really set me on a professional path at a young age, that whatever I do, that community voice and that leadership about what humans and people really want in their lives has to guide what I do. So I went back to graduate school, still focusing on humanitarian response, but started to get really interested in health and how health, really is a foundation for the rest of our lives. If you don't have good health, I think, Gertrude, you had a health emergency at some point in your life. You can just see how everything else can crumble. You can't go after opportunities. You can't show up for yourself or the people around you. So I came to understand that for me, health was this foundation that everything else could be built on. And quickly, as I turned 30 and was, having the time of my life living in New York City, falling in love, I had my own health emergency. After just a very, very routine checkup, annual visit, I heard a phrase that you never want to hear from your doctor. She said, "This is strange." And from that point on, I was rushed from test to test to test. It turned out I had cervical cancer. I needed emergency surgery. I hadn't had kids yet, but I had exceptional care. They were able to make sure I could still later have a family, but completely cured the risk that I had at that time. And it really left me questioning why I was so lucky to have access to this when so many women around the world do not have this type of opportunity. And something that I was able to survive very easily is something that other people would not. So I am really honored to now be leading an organization called Watsi. And what we do is quite simple. We have a platform online, watsi.org, and anyone anywhere in the world can go there, meet a patient who needs care. Quite a few of them are cervical cancer patients, women all over the world who need access to surgery. The cost is often relatively small. In many cases, we're talking $200. And so what we see on Watsi is that if Joan in Belgium and John in rural Indonesia are able to all give $5, we can easily help people around the world. And so through this model of everyone joining in, this kind of collective good that takes care of each other, we have now been able to help more than 30,000 people around the world. And we've raised $20 million trying to get it to those who need this care the most and do it in a way that's radically transparent, efficient, and direct. And at this moment when there's so much change and uncertainty happening in the world, this has been an incredibly powerful way to keep healthcare access for people who otherwise would have lost it or never had it in the first place.
Wow. What an incredible story.
I don't know if I touched on everything, but quite a wandering path, huh?
It is incredible. You know, you said something that really hit a nerve. Your health is your wealth. Unless you are vibrant and healthy, you can't look after yourself, your family, or anyone else. And a lot of people don't have the privilege of getting access to healthcare, like you're saying, because of the cost.
Yeah, and it's still such a barrier. And we see sometimes it's the cost of the care itself, and sometimes it's very simple things like getting off of work or getting to, transportation to the hospital. These very some seemingly small things actually can be huge, huge barriers to people. But one of the most beautiful things, I think, knowing that this is the Her Story community, something so special about Watsi is we ask every patient their story. And that's what we share. And that's what I think inspires everybody to really join in. Because when you are reading about someone who, I'm a mom of 2 boys. And so when I read a story of a mom of 2 boys, even if our circumstances are so different or we live in a vastly different place, I can get a small glimpse of what that's like. The pressure she's under, her hopes for their future and to be there for them. And some of those values and dreams are truly universal. And health is something that puts those really at risk, but yet is so solvable. We know how to treat so many of these conditions. And so it's these artificial barriers that have been put in place that we can break through.
Yeah, that's really true. Now, explain the concept of micro-philanthropy and why it works so well.
One of the trends that I think is worrying is there are starting to be fewer and fewer small donations and more mega donations. So and that's what you see on the front of the newspaper. It's like Gates Foundation and some of these, mega millionaires give a large gift to a university or something like that. Yes. But actually what is so beautiful and has existed for centuries in every community around the world, it's just people taking care of each other. And often that means coming together to take care of each other. We can't all save a life on our own, but little by little, poco a poco, we can really make a difference in each other's lives. And micro-philanthropy, or what we also call people-powered philanthropy, is this concept that collectively, together, each doing our small part, we can make tremendous, tremendous change in other people's lives and in our communities and in communities on the other side of the world. So I'm so inspired. We have on Watsi, we have some people who they come every single day and they give $5 to a different patient and read their story. There's a tech executive that I've come to know really well. And every morning he writes in his journal and sends a donation off to a patient on Watsi. Yes. We have, an artist who, she doesn't earn that much, but every bit that she does, she gives a little bit back through Watsi. One of our biggest donors in the whole world is a nurse who just has said, you know what, I have enough. And I want to make sure that other people do too. So intentionally, she knows every month, this is how much I'm going to give. She's done that for 10 years and now has helped hundreds of people around the world. So this is what micro-philanthropy or people-powered philanthropy that we all have a role to play, and each doing our small part collectively that can make a huge change, whether it's a giving circle or on Watsi or just helping a neighbor at a time of need. Those
Yeah.
are the things that really can help our communities thrive.
So, what challenges have you faced scaling a healthcare nonprofit through tech?
Oh, man, it's a different one every day, I would say. If we weren't facing challenges, I think we wouldn't be trying hard enough.
Mm,
Some of the things, I'd say the biggest thing right now that we're trying to break through is everyone is so bombarded with information at the moment.
yeah.
Content and messaging and advertisements and yada, yada, yada from all corners. And I don't know the stat, but it used to be, you were exposed to X number of things per day. And now, not many years later, it's like every second your brain is taking in, a million different inputs, right? So I think for us, the biggest thing is, how do we get our story out and how do we cut through to people to actually capture a moment of attention and convey the power and the impact of helping someone through Watsi. So for us, I think that's how do we get these really authentic stories and voices. To me, that's what does cut through when you have that empathy or that moment of connection with someone's story. That's really what you remember, and what can drive you to take action. It's not all the big there's 17 million lives lost from access to surgery every year. It's 5 times greater of an issue than HIV, AIDS, TB, and malaria combined. But you can hear these stats, and until you meet or hear a story of a real human and a real patient, either a mom or in some way that you connect with, it doesn't compel action anymore. So that's a huge challenge right now. I would say anyone running an organization, you have things that break and you have, some administrative headaches and registrations and deadlines of things that you wonder, like, this is not the mission of my organization. What I'm trying to do is help people access care. And yet I have this long to-do list of other things that make that possible. So I think balancing where we spend our time and how we can get the most good done each day is a huge challenge. And then more personally for me, I think, I shared I have 2 small kids. We moved back to Madison to be close to family. I think the biggest thing for me is women wear a lot of hats.
Wow.
And it's when I think about my best days, it's when I wore a couple hats really, really well. So
Yes.
I was either a tremendous daughter or friend or mom, and then also got a big win at work. Those moments feel so good. But there's other times when we just can't get all of that done. And I know there's days like that too, that we all feel.
So, how do you address gender and health equity through your platform?
We have really taken an approach of we want healthcare for all. Every community can put forward whoever is the highest need
Yes.
for support. But I will say more than half of the patients end up being women. And our highest need coming into the platform is often maternal care. And what's mind-boggling to me is this is often also the most life-saving and almost the least expensive. So things like a woman in obstructed labor who needs an emergency C-section, that type of care saves both the life of a mom and a baby. And we know how to do it. And so it is so heartbreaking when the pieces don't fit together and we can't act fast enough, or, they don't know that this is an option. Those moments just break my heart that there are answers out there and yet they were still inaccessible to people.
And how do you balance data, impact, and human emotion in your reporting?
Oh, this is what it goes back to, we can share all the statistics in the world, and we do. At Watsi, we try to be radically transparent so you can see For example, we have a document, and it's simple. It's just a Google document. It's nothing fancy, but we show every dollar that goes from us out to the hospitals to pay for individual treatment. So we want to be incredibly transparent, and share the data. But when I talk to people, that's not what inspires giving. It's the human side of what we're doing. So I like to say, we're the best of technology and humanity. We want the latest tools. We want to be using AI and machine learning to be as efficient as possible and to connect people as directly as possible. But at the same time, I never want to lose that human side of who we are and what we're trying to do in the world, because that is what inspires people to stay involved and do even more good. One example is we have a number of donors. I'm not sure if you're familiar with the effective altruism movement, but this is a community of people that's quite large, and they want to make sure their giving is the most cost effective possible. And I've had a number of people who are involved in the effective altruism movement, and they're moving, billions of dollars, an incredible amount of good. But people have come to me and said, but I can't forget that I want the human connection to what we're doing. So they feel like Watsi is an incredible balance between the efficiency, knowing that you're saving a life, but also, the empathy and the connection, and wanting to really know the impact that you're having on others.
So why do you believe that Watsi is a corner of kindness on the internet?
I love this. It's partly my personality, but also just how Watsi shows up in the world. We try to be a source of, brightness and good news, and really show people that with a small amount of effort, we can have such a positive impact in people's lives. And it is such a joy for me to talk with people about what inspires them to give and what inspires them to help. And, it might be something small. I had one patient who said, I read this story about this boy, and he wants to be an engineer in Kenya. And it talked about his mother and how she's trying to make that possible for him. And I'm an engineer, and my single mom did this for me too. And it still gives me goosebumps. I mean, these people had very different lives, but found connection in this story. And so we're trying to unlock more of that and show that even in such small ways, kindness can really fuel the world. It's 2025 when we're talking. We're midway through the year, and it's been an incredibly challenging year for everyone. I'd say the buzzword probably that's been used more than any other time is uncertainty, change, hardship. And through all of that, I get to see every day people showing up to help each other. We have some people who, give extra when they feel like the world is moving in the wrong direction, but they know this is one small thing they can control. For the hospitals that we work with around the world, we work with a number of hospitals along the border between Thailand and Myanmar. And with all the foreign aid changes, a number of the hospitals in the refugee camps there actually closed for a while. And it was through our programs and our support that, women were still able to get the C-section that saves their lives. And so when it's sometimes heartbreaking and you can lose hope, but actually when you listen to the people that I get to work with every day, it's impossible not to have hope. It really is. And I'm sure you feel that way with all the people you're talking to. Community is what we need right now. And hearing these stories can keep us all inspired, can keep us driving forward, and unlock more ways that we can support each other in the world.
So what's the next big goal for Watsi's growth and reach?
We feel like, we're at a stage where we have proven that this works. This is a way to really change lives. This is a way for people to have meaning in their giving. And so for us, the biggest question each day is, how do we bring this to more people? What other
Right.
communities should we be in? What countries should we be going to? How can we get more companies and networks of people involved to really grow this movement that has started? And so
Yes.
I would say right now we're trying to analyze, hey, where can we have, when we look at the next 5 years, be able to reach the most people? What
Right.
systems could we plug in? Where are the gaps that are the biggest that our innovative financing model can really close those gaps?
Right.
And along the process, help change the system so that in the long run, people have more access to care.
I love that. So, how can listeners get involved or contribute beyond donating?
So many ways to get involved. I'd say the biggest thing is to take time to read stories of people around the world who need this care or who have access to that care. And I guarantee you, you will be inspired.
Mm.
On Watsi, you can read everyone's personal story. You can see all the people from all around the world who've joined in to help. We also have an incredible volunteer program. There's people from all over the world who help review every story that comes in. So my morning every day, I sit down here in Madison and get to review every case that has come in from all the world. And then our volunteers go to work getting them ready. And it's usually within just a couple hours, they're already live on our site in real time, raising funds. The patients, I should mention, can go ahead and get their care while we're raising the funds. We don't want to hold anyone up. It's a medical decision to move forward. And we'll even pay the hospitals before we've raised all the money. So we want to be reliable, consistent, and make care happen faster and make higher quality care possible. So any way that people can help share our story, connect us with others who might be interested, volunteer to help us
Right.
edit these stories are all phenomenal ways to spread the word about what Watsi's up to. One area we haven't talked through much yet, but is really important to us is our involvement in looking at how to close the women's healthcare gap. So there
Right.
has been quite a bit of movement and research on this that Watsi's, really been honored to be part of, sharing really the human impact of the
Right.
women's health gap. And so we've teamed up with the World Economic Forum and Davos, some of the largest companies in the world, and in a really full circle way. One of the working groups I was on this past year was the cervical cancer working group, looking at how do we make this care available to women everywhere, knowing that this was something I personally faced. And now I'm in a room with the largest pharmaceutical companies working on this, ministers of health, Watsi talking about how we can fund this care directly for women. So I think one thing that keeps me hopeful is knowing so many of these people who have an ability to move a lot of resources are
Right.
starting to focus more on women's health and look at issues that for too long have impacted women disproportionately or haven't had access to treatments, or even the step before that, the research hasn't been done to figure out how women, might respond differently to medications or conditions impact us, differently than men. So
Yes.
there's finally feels like a lot of movement around this, and I'm really honored that Watsi can be a part of sharing what's happening at the community level. What are the actual needs that women are telling us they want in their lives? And how
Mm.
do we keep anchored in those as we try to drive these global solutions that can have big, big positive change?
It is just amazing. Now, my last question for you, I am going to have a bit of a thought experiment and teleport you back to the younger you, this young woman who saw a need, decided to step up and make a difference. Just in case there's other women who are listening to this podcast who are hoping to lead in tech or impact, if you could go back and give yourself 3 nuggets of wisdom based on what life has taught you up until this point, what would those 3 nuggets of wisdom be?
Well, the first one is something I mentioned earlier, and that's if a door opens, walk through it. So when I was just 23, 24 years old, I was flying home from an internship and a small project in India. I had just a small layover in Bangkok, Thailand, and I managed to get coffee with someone at the UN office, and they said, "Would you like to stay and be our very first intern?" And I said, sure. And I didn't take the rest of the flight home. And that moment of just saying yes and walking through that door has changed my entire life and the trajectory I've been on. I'm really grateful to everyone who helped open that door for me. But it also took, an internal voice and strength to say, like, yes, I'm going to walk through this door, even though I'm on the other side of the world, even though I'm alone, and even though I don't know exactly what's going to be out there. So that would be one. The second is, to be very intentional about the people that are in your community, and who you invest in and who invests in you. And so when I think of especially the women in my life, I am so inspired. I'm sure many of you have this too, but I have a group chat, a WhatsApp group chat, and we are constantly like just cheering each other on, blowing each other up with how wonderful we think we are. It's also a place for hard moments and help if we need it. But having that community, and it's been, years and years of investing in these friendships and relationships, but that's like family now. And I would never be able to take the risks I do, or the leaps, without having that community around me. So I think being very intentional about building that and investing in that in your life would be number two. Gosh, and number three, I would say probably be open and on the lookout for joy and awe, in small ways throughout our day and in huge ways throughout our lives. This orientation has really kept me grounded and positive, even when so many hard things are going on. By practicing these small moments of gratitude, joy, and finding awe and curiosity in small things throughout the day, is what can really make life still really, really wonderful, and allows other people to approach life that way too.
Oh, I absolutely love it. Now, because you're into social impact, I'm going to end our interview with one futuristic question this time.
Great.
And I will teleport you to go and meet the 90-year-old you. And she's sitting in her rocking chair with science and technology. You're probably on a dance floor somewhere or helping in a refugee camp. If I could teleport you into the future to meet this wise woman who has led you up until this point, what will you say to her when you finally meet her?
What a nice moment to take a minute to think about. I think as you're describing her, I'm picturing alongside her family. I'm picturing my two boys, my husband, and that we're there together, and that everyone is healthy, and has also found ways to dedicate their life as well in some form to bettering the life of others. But I think to wise, a little bit more gray haired, I'm already on the start to it. To wise 90-year-old Mackinnon, I'll probably just say thank you, for helping me be authentically me and trying to just live each day, making the best choices I can to be conscious of taking care of myself and also the people around me. And know that through small actions and big ones, we were able to leave a positive stamp on the world. There's no better gift than that, than feeling, at the end of your days, you're surrounded by your loved ones, and the world is just a little better off, for the actions you've taken and the decisions you've made. So that would be my hope.
Absolutely beautiful. I love asking women that last question because a lot of times women don't realize that the wise woman is already in us, that she is that quiet voice that whispers, go through that door, like you said in the beginning, take this opportunity, make a difference. And we look outside of ourselves for solutions all the time instead of going within. So I like to share a little game that I play where I play with the energy of who I am becoming. And I talk to her. I talk to my 90-year-old woman. I ask her questions. If I'm struggling with something, I go to sleep with a question as simple as, so what is the next step? And I sleep on it. And then I wake up in the morning, I'm in the shower, and I have those light bulb moments, and I know exactly what to do to execute the next step. So thank you for listening to your inner wisdom.
Oh, it's so true. I had the joy of when I first stepped into this role. I was a part of a program called Women's Impact Alliance, and we got assigned executive coaches. And that's one of the biggest things that I worked on with her was so many of the answers are inside of us, and these vision, for the organization I'm leading is here. And sometimes, I spend a lot of time looking outward, talking to community, talking to the team, my board, but actually so much of it is deep within, and we often know the right thing to do, but it's taking those more intentional moments and sometimes quiet moments to really tap into that.
That is so true. No, thank you so much for coming online and inspiring our community this morning. It's an absolute pleasure.
My honor. And I hope I get to hear so many more stories from this community and meet so many more incredible women like yourself in person. There's just something magical about people being able to share who they are and what shaped them, but then also finding those moments that we share with others and have that connection is one of the greatest joys.
Thank you. And thank you to everybody who tuned in today. The Her Story Circle is not just a podcast. We're a social impact movement that brings you the stories and voices of women from all over the world. We share our stories to uplift you, to inspire you, to energize you, but most importantly, to take you from where you are now to where you're trying to go. So if you have been looking for a cause, a way that you can make a difference in the world, go onto Watsi's website. $5 can make a tremendous difference in somebody else's life. I'll be back again tomorrow, everybody, with yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world, and bye for now. Thanks again, Mackinnon.
Thank you. Such a joy. Thank you so much for bringing these stories to the world.
Absolute pleasure. Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep making her story. Thank you.